morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update, and thank you so much for joining us today. So the CDC put out new guidelines in the last week. Davidson County started those same guidelines on May 14th. So Davidson County will mirror what's happening with the CDC. CDC said that fully vaccinated individuals can stop wearing their mask and stop physical distancing both indoors and outdoors, except on public transit, and that's planes, trains, and buses, in hospitals, in homeless shelters, and except where required by federal, state, local, tribal, or territorial laws, rules, regulations, including local business and workplace guidance. The unvaccinated need to continue to wear their masks since they are at more risk. Those who are immunocompromised should check with their physicians before they stop wearing a mask and stop doing social distancing for their protection. The CDC stressed that they recommend for everyone who has no contraindication to get vaccinated to move us closer to safely resuming the activities and things that we know and love. Now, the recommendations are based on new evidence that often clarifies and reinforces old recommendations. For example, new studies confirm that SARS-CoV-2 is spread by not only droplets, but airborne transmission. Secondly, that the virus particles are airborne for farther than 6 feet. And 3, that it lingers in the air for at least 3 hours. The numbers of cases and deaths are finally on a downward trend, but the variants are here. The predominant variant in the United States and in this area, Davidson County in Tennessee, is the B.1.1.7 from the UK. The dominant variant from India has been identified in the UK. So the pandemic is not over. The variants are on the move. Vaccinated individuals are much less susceptible to get an infection, but they can get a mild case of COVID-19. The vaccines are working as intended to prevent severe disease and death due to COVID-19. However, these results are more evident in states with more aggressive vaccine rollouts. Studies reported yesterday showed that 94% of fully vaccinated healthcare workers showed prevention of symptomatic disease, and decreased transmission was noted in those fully vaccinated with Pfizer or Moderna's vaccines, the mRNA vaccines. Now, Pastor Maxwell, the health ministry, and the leadership are in agreement to continue with our reentry plans as discussed for the last several weeks to months. 250 registered members will attend one in-person service per Sunday, beginning promptly at 9 a.m. This starts Sunday, June 6, 2021. Members are asked to arrive early for a brief screen at designated entry points. Inside, we will wear masks, wash our hands, and practice social distancing. Now, social distancing will be observed by avoiding physical contact with persons outside our household and by continuing to a hostess-guided seat based on physical distancing, not where we want to or used to sit necessarily. Now, these recommendations are discussed in the second Conversation with the Pastor video, which you'll be able to find on our social media outlets. Additional information and instructional videos will follow in preparation for June 6th and the weeks thereafter. This guidance will be continually reviewed to safely seat our church family and determine when changes from this original protocol are required. For those without internet access or who have difficulties with the technology, contact the church office or your deacon for assistance. The more of us that are vaccinated, the more the case numbers and deaths will continue to decrease, and the sooner we can gather safely without restrictions. In the interim, watch for the updates regarding reentry and changes that may occur before and after reentry starts. Your cooperation is greatly appreciated to ensure the safety of everyone in attendance. Now, we are reviewing other CDC recommendations from last week, including the Pfizer vaccinations for children ages 12 to 15. This would allow them to return sooner to their normal activities. Presently, we agree that children ages 12 to 15 who have comorbidities should be vaccinated without hesitation. Actually, younger people, rather than the elderly, make up an increasing number of the new cases that we're seeing at this time. Now, Meharry will again partner with Lake Providence to do another drive-through Pfizer vaccine clinic on Friday, May 21st from 9 a.m. to 1 p.m. This provides the second Pfizer dose for those who received the first dose on April 30th. And if you wish, the first dose can also be received on Friday, May 21st for those who desire vaccination. Registration is recommended, but is not required. As always, remember to stay safe, stay healthy, and stay prayed up. Have a blessed week.